Good day, viewers. I am Dr. Mrs. Olutoyin Sonuyi, PT. I'm a physiotherapist, retired. I'm here in conjunction with El Gracia Child Health Foundation to speak with you on pediatric care in medicine. And I'll be talking more on the physiotherapy aspects. To do justice to this, I need to first tell you what physiotherapy is about. Physiotherapy is involved in the treatment of injuries, diseases, and deformities without the use of drugs or surgery. In physiotherapy, what we use in our treatment are heat therapy, cold therapy, exercise, and massage most of the time. So, and in pediatric physiotherapy, the aim of physiotherapy in pediatric conditions is to treat the children from 0 age to adolescence, 19 years. And in doing this, you need to have a lot of knowledge about children, their developmental milestones. What I mean by developmental milestones are those activities that the babies or patients are able to carry out at every point in time in their growth, like neck control. There is a period of time that one should come up, like being able to sit, to stand, to walk. Once the baby is not going according to the period that he or she is supposed to do that, then there is need for caution and probably intervention. Today we'll be looking at some of these conditions to have information about them and what physiotherapy do in such cases. Some of the conditions we see in pediatric management are cerebral palsy, brachial plexus injury. We have some chest cases like chest infections and so on. So today I'll be talking about cerebral palsy in pediatrics. What is cerebral palsy? This is a broad term that describes a group of neurological, or brain disorders. It is a lifelong condition. For every movement that is done by everybody, there is usually communication between the brain and the muscles to carry out that movement. Once there is imbalance in this, then it causes a lot of uncoordinated movements and posturing. And that is what basically cerebral palsy is all about. The usual cause for this is lack of oxygen to the brain. Genetic conditions could cause it. Infections, brain hemorrhage, severe cases of jaundice too, and sometimes head injury. Some of the symptoms that we see in these cases are muscle weakness, poor motor control, stiffness or rigidity, which we call spasticity. And in cerebral palsy, there are different classifications. We have spastic diplegia. In this case, either both arms or both lower limbs are affected. We have hemiplegia, where one side of the body is affected, the arm or the leg. We also have the quadriplegia, where both arms and both legs are affected. We also have the athetoid type. This one it involves involuntary movement, purposeless and rigid movements that the patient will do. And then we have the ataxic, which involves imbalance. The patient is not balanced when moving. These are different categories that we see in cerebral palsy. Other things that are notable in cerebral palsy cases are seizures, vision impairment, hearing impairment, speech problems, and intellectual disability. Respiratory problems too can be part of it. Bone abnormalities too sometimes do occur. And the treatment of cerebral palsy is a long-term one. It takes, sometimes it could be for life, because the coordination is already impaired, and as such, we need to monitor that patient every time and work towards, as much as possible, independence. So in the management and care of cerebral palsy cases, both the caregiver and parents must be involved in their treatment. And for physiotherapy, in this case, we usually, after assessing your patient, you know what the patient will require. We have some gadgets that help the patient to be able to live a good life, like the chair. We have special chairs that are made for cerebral palsy patients. We have what we call standing box to train the cerebral palsy cases. We also have walkers for those of them that are able to do the walking. Then exercise like passive movements to reduce joint stiffness, to make the muscles to retain their tone, are done. Massage too is done to prevent the skin from getting dried up, and even to make them the muscles, the tone to be retained. So those are things that we usually do for cerebral palsy patients. So that's in a nutshell about cerebral palsy.